Well, pharmaceutical scientists say some research outcomes make little or no impact because of mismatch between study and healthcare needs. They blame lack of national development plan linked to tertiary education, poor integration of relevant stakeholders for this. Experts say stronger collaboration between pharmaceutical and social scientists on health issues is needed to address the challenge. They were speaking at this year's edition of the Faculty of Pharmacy and Pharmaceutical Sciences Week celebration at the Kwame Nkrumah University of Science and Technology. Mahmoud Mohammed Nuruddin has more.
Eliminating difficulties associated with utilization of research outcomes requires people's compliance. Professor of Pharmacology and Toxicology, Professor Alexander Nyako, says scientists and students should consult with their counterparts in the healthcare delivery sector. He also wants policymakers and industry players to identify health-related challenges to enable them adapt research and development strategy to address them.
He who pays the piper calls the tunes. So if I write to NIH for funding, I'm going to pursue research set by them, the agenda set by them. As a nation, we haven't put money aside for researchers to tap in so that, let's say, the nation has set research agenda, eradication of malaria. This is a vote of funds for it. Maybe elimination of tuberculosis. This is a vote for funds that researchers can use to do research, which will feed back into the system. So what generally is happening is researchers are doing things that they believe are important to them. And sometimes that may not be the needs of the policy people. So then that's what I call mismatch. There is a disjoint. The policy people need some information.
There's also concern about absence of well-structured institutions to oversee health research, targeting all diseases, for which reason health research is haphazardly executed.
If we can go down, maybe health research, then maybe industrial research and all that, then things will be properly coordinated for the units to be able to set proper agenda that will feed back to solving problems. If you look at the United States, for example, they have the National Institute of Health, NIH, and underneath you have kidney diseases, you have cardiovascular disease, you have cancer, you have this, and government money goes there. It's not free money for researchers, but researchers competitively apply for the funds. So if 3 people put in an application and one is best, they'll give the funds to him, and therefore the results go back to them and you can implement results. But as we hear, I want to be promoted. If I don't do research, the university will not promote me. So sometimes from my pocket, I identify a small area and I tackle. And I'm not in touch with Ministry of Health, so I don't even know their priority areas. So I get my paper, it's useful, but he too, maybe he's interested in malaria and I'm interested in something else, so there's a mismatch.
If I take you to our library now, you find a lot of research theses that you have written, key things that you should have taken, key things that you could have done. But it comes to your point, as I said earlier, you don't have the strength and the resources, so you just shelf it.
There's another challenge the health experts once addressed.
We have problem with our labs. One, we have structural problems. You see, the labs were designed to handle fewer students. Now the student intake has gone so high. My time we were about 35, but currently we are talking about 350 students. That is 10 times that number. We are still using the same labs that we used during our time. The equipment, most of them are obsolete, and we need newer equipment. But funding for these things are not forthcoming, and therefore we know that for us to move forward and to be able to do the things that we hope we can do to help the system, it means that we have to restructure these labs.
Pharmaceutical scientists are hopeful clearing such hurdles will see a more workable system that puts people at the center of all activities. Mohammed Nuruddin's report for JoyNews.